The U.S. healthcare system is one of the most politicized issues and organizational structures that affects every single person living in the United States. For the purposes of this course, we'll make a distinction that health and health care are not the same thing. Health is affected by health care, but is not determined by it. There are many other factors which impact a person's health, including social determinants such as poverty, stress, access to high-quality foods, etc. Yet, as we will see, most emphasis in the United States is placed on improving our health systems rather than in focusing on improving our health outcomes. Is this the same for all countries? As we learned in a previous lecture, the purpose of a healthcare system is to improve the health of its people and is achieved by reducing the burden of disease, improving access to health information and care, ensuring quality health service, and protecting individuals from the costs of illness and treatment. When U.S. citizens are asked how they would rank U.S. healthcare, the polls reflect the feeling that U.S. healthcare is the best in the world. And yet, while recognizing that there are millions of people living in the United States without access to health insurance or health care, and that the health status of people in the United States is among the lowest of any country in the Organization for Economic Cooperation and Development, the debate is focused on the efforts to reform or improve the healthcare system, known as the Patient Protection and Affordable Care Act, or Obamacare. Former House Speaker John Boehner trashed President Obama's healthcare plan in November 2013, accusing him of wrecking the world's best healthcare system because he does not feel that the government can fix the healthcare system. Please watch the video clip titled Boehner, Only Healthcare Fix is Scrap Law, if you haven't already seen it. Nevertheless, questions remain from this statement. Does the U.S. have the best healthcare system in the world? Are there problems with the current system that need to be addressed? And what is the role of the public sector, the private sector, the civil society or nonprofit sector, and the role of individuals? Americans pay more per capita for healthcare than people in any other industrialized country. In return, we are sicker, die younger, and are unhappier with the system even though we think it's the best in the world. In its 2014 publication, Mirror, Mirror on the Wall, How Performance of the U.S. Health System Compares Internationally, the Commonwealth Fund demonstrates that Americans spend more on health care than any other OECD country. According to the OECD figures, the U.S. per capita expenditure in 2011 is $8,508, compared with the average among OECD countries, which is $3,182. And in 2011, the U.S. spent about 17.7% of its GDP on health, compared with an average of only 8.9% for the other countries. According to a recent report by the U.S. Centers for Medicare and Medicaid for 2014 to 24, health spending is projected to grow at an average rate of 5.8% per year, 4.9% on a per capita basis. Health spending is projected to grow 1.1 faster than gross domestic product, GDP, per year over this period. And as a result, the health share of the gross domestic product is expected to rise from 17.4% in 2013 to 19.6% in 2024. In spite of spending more than 66%, Norway, the country with the second highest per capita expenditures at $5,660, the U.S. does not achieve higher rates in the quality of care, access to care, or the other measures such as efficiency, equity, or healthy lives. According to the study, the U.S. ranks last overall with poor scores on all three indicators of healthy lives: mortality amenable to medical care, infant mortality, and healthy life expectancy at age 60. In all of these indicators, the U.S. ranks last of 11 nations. Among the indicators in which the United States does measure better are in providing effective care, which ranks number 3, patient-centered care, which ranks at number 4, and timeliness of care, ranking at number 5. According to the OECD measurements, effective care is defined in two groups: prevention and chronic care. Patients in the United States are more likely to receive preventive care reminders and advice from their physicians about diet and exercise. The US is third on effective care overall, even though we are about average in comparison to other industrialized countries on the quality of chronic care. The United States also does better in terms of patient-centered care, in which the care is delivered with the patient's preferences in mind. Although the United States ranks fourth behind the United Kingdom and Switzerland, the Commonwealth Fund believes that all countries could improve substantially in this area. With regard to the timeliness of care, United States patients report relatively rapid access to specialized healthcare services. However, these patients also face financial burdens and are far less likely than patients in the United Kingdom or Switzerland to have rapid access, the same or next day, to primary care when they needed medication attention. One of the most common mistakes that the Commonwealth Fund points out is to associate universal or near universal coverage with long waiting times for specialized care. They state that the United Kingdom has short waiting times for basic medical care and non-emergency access to service after hours. The United Kingdom also has improved waiting times to see a specialist, with the United States ranking third. They explain that patients in the Netherlands, Germany, France, and Switzerland have rapid access to elective or non-emergency surgery compared with patients in the United States. Canada ranks last on most measures of timeliness of care. The United States did not fare so well in any of the other indicators. Among the 11 countries, the United States performed particularly poorly on measures of access, efficiency, equity, and healthy lives. 37% of the respondents said they did not receive recommended care, fill a prescription, or visit a doctor or clinic when they had a medical problem because of cost. They also reported negative insurance surprises and the highest rate of serious problems paying their medical bills. 59% of physicians in the United States believe that affordability is a problem. On indicators of efficiency, the United States scored last with poor performance on the measures of national health expenditures, measures of administrative hassles, timely access to records and test results, duplicative tests, and rehospitalization. Sicker patients in the United States and Canada were most likely to visit the emergency room for conditions that could be treated by a regular physician. Equity is defined by the Institute of Medicine as providing care that does not vary in quality because of personal characteristics such as gender, ethnicity, geographic location, and socioeconomic status. The US ranks low on access to care measures, especially for low-income adults. 30% or more of all lower-income adults in the United States reportedly went without care due to costs in the past year. This includes not visiting a doctor when sick, not getting a recommended test, treatment, or follow-up care, or not filling a prescription or skipping doses when needed. With respect to healthy lives, the United States also fares very poorly. The goal of a well-functioning healthcare system is to ensure that people lead long, healthy, and productive lives. Using 3 measures, the United States ranks last for deaths that could have been prevented with timely and effective care, last in infant mortality, and second to last in healthy life expectancy. The Commonwealth Fund report suggests that there is a strong relationship between the effects of health insurance coverage and the quality of care experiences reported by U.S. patients. The Patient Protection and Affordable Care Act is designed to address some of these issues. The provisions of this act, including the new health insurance marketplaces, should contribute greatly to the stability and security of coverage and increase access to health care and improve health outcomes. For this lesson, be sure to look more closely at the United States healthcare system and begin to explore the other systems in comparison.